and I can see online that many of you are just as excited as I am. You will notice that last month, Blue Heart Medical had Sexual Awareness Health Month. We are unfortunately known as the STI capital of the world. So it's very important that we become aware of our sexual health and do everything that we can to keep safe. I've received 2 questions, which I'll be answering. The first one is from someone who says, I need help. I had unprotected sex with someone who is known to be HIV positive in December. Now I'm suffering from chest pain, heart, eyes. They don't know what's going on. Our second question is how to be safe during sexual intercourse. So it's very important that you protect yourself during sexual intercourse. Unfortunately, for some, because I know some people don't like condoms, the best way is to condomize or put on your jacket. I know people say it's like eating a sweet with a wrapper on. Unfortunately, that's the best way to protect yourself. As I said, we are known as the STI capital of the world. So for men, there are condoms that go onto the male penis. Remember, when you are using your condoms, use water-based lubricants. So don't use things like Vaseline or oil or anything like that, because it can increase the risk of ripping the condom. For women, there are diaphragms, which you insert at any time of day, and then you can be ready to go whenever you're ready. Remember also to check the expiry date of your condom on your diaphragm, because if it's expired, it is at higher risk of rupturing. If it does rupture during intercourse, or like this person having unprotected sex, you have 72 hours, which is 3 days, within which to go to your healthcare provider and get yourself post-exposure prophylaxis. We call it PEP. So basically, it's HIV treatment that will help to prevent you from getting HIV. But again, folks, the best thing to do is to keep safe. Put on those condoms, use those diaphragms, look after yourself. And now I have dental related questions. I've received a few. The first one says, my kids' teeth are rotten and it's not because of sweets or anything they eat. What could be the cause and how can I stop it from getting worse? So I know with younger children, some families would give them milk or tea or juice overnight. So ideally, kids should not be having anything overnight, especially once they are older, maybe older than the age of 1 year old, or once they start sleeping throughout the night. They shouldn't really be sleeping with a bottle in their mouth, because even milk has sugars in it. If you put sugar in tea, juice obviously has a lot of sugar in it, and that sugar can cause dental caries or can cause the teeth to be rotten. So try and avoid giving your older children or your toddlers milk overnight or any kind of fluid overnight. And I would suggest that they brush their teeth twice a day. So once in the morning and once in the evening before bedtime. It would obviously be highly recommended that they see a dentist as well. But I think the brushing of teeth and avoiding drinks overnight can help quite a bit. And the second question says, I have loose teeth and they keep falling. It doesn't hurt, but is there anything else I can do besides braces? Okay, this case, I think you need to see a dentist so that we can understand why are your teeth coming out. It could be gingivitis, which is inflammation of the gums or infection of the gums, which can lead to maybe the teeth becoming rotten and the teeth falling out. There is something called Invisalign and other versions of it, which you can actually get without a dentist. And it's a series of basically invisible braces that you put on overnight or during the day, and it helps align your teeth. Obviously, it's not as great as going to a dentist because it's not individualized to you. So I still would recommend that you see a dentist. But for those without major dental issues, it might help you to straighten your teeth on a budget. Our last question is, I have a chest problem, especially if I'm stressed too much, or if I'm overthinking or thinking about things that happened long ago. What could it be? So this could actually be a sign of anxiety. So you may find that your heart starts beating fast, you start sweating, chest pain, chest tightness. Those are all signs and symptoms of anxiety. So I would recommend that you see your healthcare provider, or you can speak to a family member, speak to a counselor, see a psychologist to help you deal with whatever issues are causing you the stress. Psychologists, people think, are for crazy people or people who are not coping in life. Sometimes it is good, it might not even be many sessions, but once in a while, see a psychologist. They help you with coping strategies for that particular thing or that particular phase in your life. And it empowers you so that if you have a similar encounter later on in your life, you know how to deal with it. I hope you found all of this helpful. Thank you so much for tuning in. Join us again. Please remember to send your questions, DM us, or send us a direct email, or send questions to our WhatsApp line. Keep well and keep healthy.